Hirika GOSALIA.
Very good morning to everybody. I'll be talking about Scrub Book, a perfect surgical Digi logbook for every resident. So, do we all remember our first day in the OT, our first cataract surgery? Uh, I mean, the comments that were given by our trainer, why we were so nervous about it. So yes, obviously, I mean that must be one of our most important day. And the important question here is, how did we perfect our surgical steps and tackle those complications? So how I did it in my residency was I used to document all my surgical details and the complications in a Excel format on my iPad, and wherein I had the demographic data, the surgical data. Uh, all the complications, and then the steps that were assisted by the seniors, and the steps that I did, and the steps done by the seniors. And over time, I realized that my complications reduced a lot only because of the fact that I documented and I could review my cases, and it helped me improve. We also did Oscar grading for every case, wherein the trainer used to score us for every step of SICS. And I think even that really helped us improve because we would know exactly which step is the step that we require more training and we need to sharpen our skills. So, over time, I realized this could be a really tedious job to record all surgical data, especially if you're working in a high volume center. Trainer cannot moderate it exactly because you might be documenting it, and it's difficult to review it as a whole. So there's a hackathon that happens every year in Arvindai Hospital, Pondicherry, and that's when we came up with this app called Scrubbook. So this is how the Scrubbook app works. So the trainee has a login ID, and they will add a patient data wherein the entire MR number, details of the patient, the demographic data, date of surgery, the anterior segment diagnosis, posterior segment diagnosis, this eye operated, pre-op vision of the patient, pre-op astigmatism, post-op under-corrected vision with pinhole, post-op astigmatism, complications intra-op on day 1, day 30, what could be the reason of the complication, the steps that were assisted. You can even upload a video link of your surgery video. So in this way, the trainee could exactly put in everything, how we put it in our Excel, but in the app format. And you could view all your surgeries at a glance in one go. So while for the trainer, they also have their login IDs wherein they'll form their account, and then they can review, they will have an account wherein they can put Oscar grading for that trainee, and they can review their log IDs like, oh, what are the patient's complication on day 1. So this is how easily it could happen for both the trainee and the trainer just through an app. So the aim was to evaluate the app's usability, effectiveness in tracking surgical performance, and its impact on residents' learning and confidence. So 20 residents from various years of the training were participated in this study. And at the beginning and the end of the study, the participants completed the surveys wherein they assessed their previous experience with surgical logbooks and their expectations from the app. They were also asked to rate the app's ease of use, usefulness, any improvements that they felt were needed. And at the end, their qualitative feedback was collected. This included the number of surgeries logged, the time spent, the frequency of feedback requests from mentors, that was to check the efficiency of the app. And in addition to collecting the qualitative feedback, residents' self-reported confidence level in their surgical abilities were compared before and after using the app. This comparison helped us assess whether the app had any impact on the surgical learning curve. So the results were app usage and over the course, at least 15 surgeries were logged in the app. Average time taken was approximately 5 minutes, indicating that the app was both time efficient and user friendly. Majority, 90%, used the feedback feature regularly and requested post-surgery feedback from their mentors, which was highly appreciated. Resident confidence and learning showed significant improvement. 50% rated their confidence in performing as high after using the app. Additionally, residents reported feeling more aware of their surgical progress and areas requiring improvement. Mentors also reported that the app facilitated more structured feedback and enabled them to monitor the residents' progress. They noted that the ability to review the surgical logs in real time helped them. And also, there were a few areas where we need to improve on was the surgical checklist or a more detailed analysis and delays in the app. So it is a handy go-to app for every resident or trainee, which can be used as a digital surgical logbook. Trainee can easily store patient-related data, record any records can be put in, and all complications can be reviewed at once. Can be moderated by the trainer, a surgery link can be put in, and even the Oscar grading can be done. And future prospect is to introduce statistics for all complication, alert notification on exceeding complication limits or recurring complications, surgical lessons by experts for complication management, taking it beyond cataract and for further other specialities, and to hire an expert surgeon to advise to grade trainee cataract surgeon. So, I'd like to conclude by saying that this could be really useful for all residents. Thank you.
Thank you.